Hi, very good afternoon to all the audience who join us on our social media platform. Today we will introduce you the symptoms of depressions as well as the medical treatment for depressions and psychotherapy to relieve the symptoms. Today we have Dato Dr. Fong and Datin Indranee Liew to share on this topic with us. Dr. Lai is a consultant child and adolescent psychiatrist at Island Hospital, Penang, and Indranee Liew is his spouse and also a UK and IGCSE curriculum consultant, as well as a behavior management and teachers trainer. We are honored to have them to share on this topic with all of us. So without wasting any more time, I shall pass it over to Dr. Lai and Indranee Liew. Hi.
Thank you very much. Thank you very much, Ms. Grace Tan. The video, the PowerPoint, please. Okay, thank you. Understanding depression. Nowadays, the number of cases of depression has increased, and depression can impact anybody. It can be a man, it can be a woman. It can be a grandmother, a grandfather, okay, a father, a mother. It can also be teenagers and children. And COVID-19, all right, all the restrictions and anxiety surrounding COVID-19 has created more anxiety in us, and anxiety can also lead to depression. Next.
This is a drawing by the famous artist Vincent van Gogh. If you look at this drawing of this man sitting on the chair, anyone looking at this picture will probably guess that he is depressed, right? Vincent van Gogh himself has been depressed before. He suffers from bipolar disorder. So there were times when he was really low and depressed, and at other times he became manic. But in this picture, he actually depicted very well what depression looks like. Okay, so depression doesn't only affect our mind and our emotions; it also affect our bodily posture. Okay, how we sit, how we walk, how we talk. Yeah, next.
Introduction. Children and adolescents with major depressive disorder have the same core features, whether adults or children.
So depression, we always think that depression happens in adults, old people. Nowadays, the scientists also find that depression do occur in teenagers as well as young children. So depression actually, or more correctly, depressive disorders can occur throughout our lifetime, from young to old. Okay, and so we ask a question: when is depression abnormal? When is sadness abnormal? When the sadness becomes a depressive disorder? All of us feel sad on and off. When do we say that a person is not just sad, but he's also having depressive illness? Okay, in this talk we will talk about something a bit more about this.
Differences, developmental stage and cognitive and language abilities.
Okay, the difference in the way depressed children show their depression is more to do with their inability to express themselves. So when an adult who is depressed, they can come to you and say, "I'm depressed." A child who is depressed, they don't know how to come and tell you they are depressed. So they'll probably cry more, they will throw things, they will become irritable, they will throw tantrums, they won't be able to sleep at night properly. Yeah, so we have to guess from their behavior that they may be having depression. Next. And you covered it.
Consider depressive illness. Firstly, depressive symptoms, and secondly, improvement in psychosocial impairment in psychosocial functions.
Okay. So we'll go through the symptoms afterwards.
Next. Major depressive disorder can occur among preschoolers.
Okay. So as I said, depression nowadays can actually, we realize that depression can occur from very young children right up to elderly people, grandparents, and in between. Okay, anytime we can be depressed and needs some treatment.
Next slide. Childhood major depressive disorder, usually presented to primary care or to pediatricians, usually undertreated, and the common presenting symptoms are firstly behavioral problems and secondly somatic symptoms.
So as I said, in children, when a child is depressed, usually they don't have the words to tell you. So if a child is depressed, they become more quiet, they cry more often, or they may come and tell the parents, I have headache, I have stomach ache, I have pain here, I don't want to go to school, I don't want to eat, they don't sleep well. So all these are signs, symptoms, which may point to depression. Okay.
These, all right, also are the same symptoms for adults. Yeah. Somatic symptoms, you cannot sleep. Either you cannot fall asleep or you can sleep but you wake up 2 a.m., 3 a.m. and you cannot get back to sleep. Next, okay, you are actually extremely grumpy and short-tempered. Some people, okay, are not grumpy or short-tempered, but they feel sad. Very, very sad. They'll go straight into their room, lock the door, and cry. They don't feel like, their favorite grilled salmon doesn't interest them anymore. Their favorite, whatever, TV show or game, all right, is put aside. Next. This is a girl, Sally, 17 years old, Form 5 student in Malacca. She was in school. She climbed over the second or third floor balcony in school. She died.
So depression can affect different people. You look at her photo, she's smiling, you won't guess that she's depressed. A lot of people are depressed, but we do not know because, adults, we know how to put on a smiling face. So they may be depressed inside. So just because the person smiles and looks cheerful doesn't mean he may not be suffering from depression. Okay. Next.
Next slide. Risk factors and outcomes. There is a historical myth that children cannot suffer from mental illness. We'll talk about children and teenagers first. So children cannot have depression, cannot be mentally ill. All right. Now, childhood illnesses were first included in DSM-3. DSM is what?
Diagnostical manual for diagnostic and statistical manual. It is actually a diagnostic manual for mental illness produced by the American Psychiatric Association. So it started with the famous DSM-3. Now it has gone on to DSM-5, the most recent ones. So if you want to know how to diagnose depression, you can Google depression and then DSM-5, and then they will tell you all the criteria. Okay, a person must have 1, 2, 3, 4, 5, or how many of the list of symptoms listed here. for how long, usually more than 2 weeks, then you can say the person has depression or depressive disorder. Okay. So like we say, depression can occur in children right up to adults and old people. For adults, the older we grow, the higher the risk of us getting depression. So older people get depression more easily. Partly is understandable because old people, we tend to start losing a lot of things, right? We lose our health, we lose our friends, we lose our job because of retirement, and then we lose recognition. We are no longer as important as we used to be. So we get troubled by aches and pains everywhere, by illnesses. So old people get more stressed, and so old people tend to develop depression more easily. Next.
Like, old people, they can't taste very well, so food doesn't taste so good for them. So that's why if they keep on saying that, not tasty, all right? Actually, what has happened is that it's the taste buds, okay? Then they can't see very well sometimes. So someone who's been reading the newspaper all the time suddenly now cannot see properly. So growing old is exactly the opposite of growing when you're young growing up. When you're young growing up, you learn all the skills. Then when it comes to growing older, you start to lose all the skills. Okay? So grandparents who become very irritable, scold people, or they don't talk, they just sit and then just stare, or they, for always sleeping on, always tired and all that. Look up. It could be depression. And nobody, whether you are elderly, you are middle-aged, okay, you are youth, you are a child, nobody has to suffer from depression. Okay, you don't have to suffer from it. You can actually get some treatment. Okay. At the bottom of the slide, it says that ACEs, predisposing factors. This is for children and also adult. Would you like to explain?
ACEs is adverse childhood events or experiences. So if you show the next slide.
Next slide. Okay. Adverse childhood events or ACEs. Physical, sexual, emotional, physical, sexual, abuse, and physical and emotional neglect.
So these are a list of 10 experiences which is classified as ACE. So if in your own experience when you're growing up, you have some of these experiences, the more experience that you have in this list, the higher is your risk of developing depression when you are older. Okay, not only depression, but you have other risk of developing medical problems like diabetes, cancer. If you have more of these adverse childhood experiences, so this is something only noticed recently. Okay. Yes.
All right, then hold on, please. Back. Okay, thanks. So, in the family, all right, you may have this. Okay, divorce, domestic violence, substance abuse. Okay, either alcohol or drug abuse, mental illness, and imprisonment. This also, all right, are adverse childhood events or experiences which affect the child's psychological well-being, affects the child's mental well-being, so that next time, okay, when they grow up, they will have some mental, all right, challenges. Next. This is a photo of a woman, okay. She had her second child. And after that, all right, there was no one to help at home, no? Usually, you know, we all Chinese especially, you'll have either the mother-in-law or somebody to help with the child for at least a month. She had nobody to help at home. Then, all right, one day she decided to bathe the child. So she went to the bathroom, put water in the tub, etc., started bathing the child. Then she suddenly remembered, oh my goodness, I've got a pot of soup on the stove. I better go and turn it off. So she went to turn. She left the baby in the tub. Then she went to turn off the stove. On the way back, she suddenly saw that there were some dirty dishes in the kitchen sink. She decided to wash the dishes. Where by the time she remembered the baby, I'm sure you know what happened, right? The baby had already drowned.
So this woman actually suffers from postnatal depression, very severe postnatal depression. Studies all over the world has found out that 1 out of every 10 women after they deliver their baby develops depressive illness. So 10% of women after delivering babies has a risk of developing depressive illness. So you who are ladies who is listening to this talk, next time when you get married or when you deliver your baby, during the first few months, if you start developing, becoming withdrawn, cries easily, they don't feel like doing anything, don't even feel like playing with your baby, you may be developing postnatal depression, which can be very easily treated. Okay, you can take antidepressant and you'll be all right, but you need to treat it early. Okay, next.
Next, yeah. Okay, presentation of depression, negative view of self, and self-blame. I do this one first.
You everything. Just read through.
Somatic symptoms such as headache, muscle pain, abdominal pain, lack of energy. Irritable mood, increased temper tantrums, oppositional behaviors, conduct problems, insomnia, and weight loss.
So all these are symptoms of that you can see in someone who is depressed. So when we say someone is suffering from depressive disorder, it doesn't just mean that he's crying all the time or he looks sad. Okay, the depressive disorder actually comes with symptoms, including those listed here, and some of it are describing children, like conduct disorders, oppositional defiant. That means they fight with the family members. So all these are symptoms of depression that we can see, okay, when someone is depressed. The next slide will show better.
Yeah. Okay, clinical features of depression. That means what are the symptoms?
This is one way for you to remember. Those of you who are students, you want to remember what are the symptoms in depression. You just remember the mnemonics, space DIGS, SPACEDIGS.
You notice there's a very cute astronaut on the slide. That is to help people to remember the mnemonic. S is SPACE. So when you think of the astronaut, you think of the word space. Then after that, DIGS, DIGS. Okay.
So S is for sleep disturbances. So usually someone with depression, they have difficulty falling asleep, and very often they have what we call early morning awakening. They tend to wake up very early, like 4 a.m. in the morning, 3 a.m. in the morning. They wake up and then they stare at the ceiling, don't know what to do, don't know why they are waking up so early. So that is a sign of, could be a sign of depression. Teenagers, when they are depressed, they have an opposite kind of symptoms. They tend to sleep a lot. So they can sleep from 9 p.m. at night to 12 noon the next day. They don't want to get up. They don't want to get up to face the world. So that is oversleeping. So either too little sleep or too much sleep is could be a sign of depression. Then P is psychomotor retardation or agitation. Usually adults, when we are depressed, we tend to do things a bit slower. We walk slower, we talk slower, we think slower. Older people, sometimes they get agitated. Agitated means you can't sit still. A grandma or grandpa starts walking up and down, don't want to sit. Then keep on asking the son, take me to see a doctor, take me to see a doctor. I don't feel well. So those are agitated depression. A is
anxiety.
Yeah, a person who is depressed can also be very anxious, very worried about things. Little things makes them very worried. So anxiety can be a form of depression. Can be a symptom of depression, right? And then C is concentration, difficulty focusing. Students who has depression, they cannot focus on what they are studying. They cannot focus on what the teacher is teaching. So usually their results become worse, okay, because of their depression. They can't take in what they are learning. E is energy. The energy level tend to become less. They feel that they have no energy to do anything. Low energy level. Then D is depression. The feeling of low mood, dysphoria. I is loss of interest. This is very important. This is an important symptom in depression. Loss of interest. Loss of interest in things like how do you know whether a grandmother in a hospital who is sick is depressed or whether she's just sick? Normal grandmothers, when their grandchildren come, usually they will, even very sick grandmothers, they look at the grandchildren, they will smile, they will, be happier, they will talk to the grandchildren. But if this grandmother, when the grandchildren come, don't even look at the grandchildren, unlike previously, then you may think that she actually has depression. Okay, there is a loss of interest in things that you used to like. A teenager who loves to play computer games, when he's depressed, even computer game he doesn't want to play. Then there's something not right. G is guilt. A feeling of guilt that I have done a lot of bad things. I'm a burden to my family. I have failed my parents' expectation. So all these guilty feelings can be a sign of depression. And finally, S is suicidal thoughts. People who are depressed tend to have more thoughts of not wanting to live anymore, more thoughts of wanting to end his life. So that's why it's important to treat depression, because of this risk of suicide. Okay.
Next. Now, whether it is children, the pictures here are children, it can also be adults here. Has there been a change in the person's behavior? Okay, has there been a change? So you look on the left, okay, smiling faces, all right, goes jogging, does exercise, and slowly, all right, less and less, okay, smiles and happiness. Okay? You see what there's people who are worried, who are sad, and people who are so irritable, and especially guys, if they're irritable, they end up in fights.
So the question is my friend's sadness a normal thing, or is he having depressive illness? So the question you need to ask is, has there been a change? Compare him now with 6 months ago. Is there a difference? If there's no difference, then probably it's just normal sadness. But if you tell me, oh, 6 months ago he is very active, he can joke with his friends, he goes out with us for makan, now he stays in his room, doesn't want to answer our call, then it's not normal already. That is a change. So his sadness is no longer a normal sadness, is probably a depressive illness. Okay.
And where men are concerned, they can get very aggressive into fights. What about women? Women, a lot of them will go lock themselves in the room or in the bathroom and they will cry. Okay, women end up crying a lot. Next slide. Right, PHQ-9. Now, PHQ-9 means Patient Health Questionnaire 9. Number 9 tells you that it has only got 9 questions. You can get PHQ-9 online.
Okay, so what I want you all to do is take out your phone. Take out your phone and go to Google and type this PHQ-9. Okay, you type PHQ-9, you will get a whole list of PHQ-9 questionnaires. If you can look for one that will automatically add up the score for you, then you click on it and then you answer the 9 questions. You can do it now. I'll teach you how to score your answers when you finish. Okay, go to Google, type in PHQ-9, search for PHQ-9, look for auto scoring if possible. If not, just do any of the one on the list. Answer the question, 9 questions. At the end, I'll teach you how to score and see whether you are depressed or not. Tell me when to stop, continue. Okay, all right. To score, you just add up the numbers where you circle. Okay, so if you circle 1 and then 2 and then 1, you just add up 1 plus 2 plus 1. So add up everything. Your total, if it's if it's below 10, it is quite okay. Okay. If it's 10 to 14, 10 to 14 is moderate depression. 15 to 19 is severe depression, and 20 and above is severe depression. Anything above 15, you need to go and see a psychologist or a counselor. If it's above 20, you may want to consider taking some medication for depression. Okay, so this is quite a useful screening tool. It's very available, it's free. Anytime you meet any friends or family member whom you think is depressed, just ask them to do this very quick 9-question questionnaire. Okay.
Next, yeah. Okay. Even if they are young children, you can actually assess their feelings using the preschool feelings checklist.
This is for kindergarten children.
So
to be filled by parents and teachers.
So if you just copy preschool feelings checklist and Google it, you'll be able to get it.
Okay, next.
MFQ, Mood and Feeling Questionnaire for Primary School Children.
Okay. So if you are a teacher in primary school, you can also use this one, which is also free, available online. Yeah.
Next. Self-harm. Okay. Cutting, literally taking a knife or something sharp to cut like this is usually girls. If it's boys, either they hit themselves on the head or they bang their head on the table, bang their head on the wall.
But I've seen boys who cut themselves also. So it's but usually it's among girls. Okay, why do they cut themselves next? Usually they have a lot of emotional pain, a lot of unhappiness inside, and some of them will tell you that they cut themselves because the physical pain is less painful than the emotional pain. So they feel relieved when they cut themselves because somehow they allow the emotional pain to come up. But the whole thing is not normal. So if you come across teenagers who cut themselves, refer them to counselors or psychologists or psychiatrists. Get some help for them. Okay.
Next, cutting. Okay, you see there's a girl there in the corner, and then look at the arm. It's all been cut. Usually, they will cut over their forearm, their arm, and their thighs, or their abdomen or tummy. Okay? That means, you know why they cut there? Because it can be covered by your clothes. Princess Diana used to cut herself on her thighs. Okay? Now, as a means of coping with inner negative emotions, and cutting is usually more amongst adolescent girls. Next.
Okay, this is actually a comic strip kind of technique. Those of you who are parents who have young children, sometimes when they get upset, let's say they throw things, or even if you have a teenager who cuts herself. Okay, what you can do is take a piece of paper, fold it into 9 equal boxes, ask her to draw for you the sequence of events. Let's say she cuts herself. So you put the cutting right in the middle, and then ask her to draw for you what happened that led to the cutting. Okay, maybe the first box is she was in school, and then a friend come and say something to her, then another friend say something nasty about her, and the teacher didn't help, and then when she went home, she got upset and cut herself. And then after that, what did she do? So after that, maybe her mother saw, and then her mother scolded her, or the mother applied medicine for her. So you draw the whole story in the sequence of events. After she has drawn, then you ask her to tell you the story. Okay, so you can understand what happened in a clearer way. So the drawing don't have to be very nice. You can just draw stick figure. It's more to help the child or the young person express how he feels. This can actually be used by anyone, even adults. Let's say if you have a quarrel with your boyfriend or your girlfriend, you can use this after everything is over, you can use this to draw out the event from beginning to the end, and then you figure out what actually went wrong. If the same thing starts again and happen again, what can I do differently so that things may be a bit better? Next.
Differential diagnosis: anemia, thyroid dysfunction, vitamin deficiency, viral and post-viral illnesses, diabetes.
Okay. People with medical problems sometimes may look depressed. Okay, someone with usually thyroid problems, low thyroid problem can appear depressed, lethargic, no energy to do things, no interest to do anything. So before treating them for depression, the need to get a doctor to check them out and see whether they have any of these problems. Okay, anemia, low hemoglobin in the blood, thyroid problems, some other medical problems. Okay. Yep.
Next. Treatment: biopsychosocial approach.
Okay. Biopsychosocial approach is actually a holistic approach. Biopsychosocial is actually talking about three approaches. The biological approach. So biological means physical, chemical. So we treat the brain. Okay. Psychological is emotional, cognitive. So we use psychological method to help the person. Social, we use social. See whether we can change the social environment. Okay, so if let's say someone who is very unhappy in a unit in a corporation, okay, having a lot of interpersonal problem with his colleagues, maybe a change of unit, change to another department may help. So that is a social kind of approach in dealing with the problem. Or if the person is very negative, the way he see things, the way he solve problem is usually self-defeating, then you can teach him some psychological techniques how to face problems. Or if the person is severely depressed, a PHQ 9 or more than 20, then you may want to give him some antidepressant medication to get him out of the depression. Okay, so the best way of dealing with depression is a multi-pronged approach, a biopsychosocial approach. So if a doctor just give you medicine, you can ask the doctor, can you also give me the psychosocial aspect of the treatment? So he's giving you the biological treatment, but can you also include psychological and social treatment? Okay.
Biopsychosocial approach, you can actually think of it or visualize it as a stool with 3 legs. Okay, so stool, this is what you sit on, and then you got 3 legs. All right, so obviously, if one leg is broken, okay, the stool won't be able to stand. Generally speaking, in Malaysia, if you see a psychiatrist, they go zoom to the bio part. They give you medication. All right. If you have depression and it's caused by a lot of problems last time you had in your childhood, maybe one of the ACEs, adverse childhood events, the antidepressant will help give your brain more of the chemical serotonin, so you're not feeling so low. Okay, but okay, you are not dealing with your mind here, all the thoughts that are in your mind. Okay, what you remember from your childhood. So that part needs the psychological part, and usually it is psychotherapy, like cognitive behavior therapy or family therapy, which Dr. Liew does. Yeah, and then the social part is the other people around also need what actually is called psychoeducation. It doesn't mean to make you psycho. Psychoeducation is make sure that other people in the family and all know that this family member has depression, what is depression, and how you can help depression, how you talk to people with depression, and how you don't talk to people with depression. Yeah, you're always so sad, always sitting there and crying, useless. Better you go and die. Some people actually end up with things like this. Right? Better you go and die. That's if that person takes your advice, all right, it'll be a very great tragedy. So Dr. Liew and I, all right, fully prescribe to the biopsychosocial approach. Next is working with family systems, systemic approach.
So sometimes a person is depressed is because the family is not well. So often we see teenagers who are depressed, and when we talk to them, they are actually depressed about the way the father and the mother has been quarreling every day. Every day he goes home, you hear the father and mother shouting and screaming at each other, fighting, and he just don't know what to do. Want to help them, but they won't listen. So he becomes depressed. He or she becomes depressed, not because they have depression themselves, but because the parents, he's upset that the parents are like that. Okay, so the way to help him is actually to help the whole family and get the whole family to sit down and talk to everybody and help the parents to see how their behavior is affecting their children. Next.
Behavioral activation, scheduling of pleasurable activities.
Okay. One thing that depressed people like to do is to always lie in bed. But actually, the more you lie in bed, the worse you feel, because you feel useless. You feel you are not doing anything useful. So the best thing for depressed people to do is not to lie in bed, is to plan out the day and do something. Okay, even though you don't feel like doing anything, just plan it out. Let's say 8 to 9, I will go for a walk, even though you don't feel like going for a walk. So go for a walk, come back. You can 9 to 10, you can put down, okay, I want to read a book. So you can 9 to 10 read a book. Even if you cannot finish reading a book, it's fine. You just read a little bit and then after that you put it down. And then 10 to 11, maybe play with your pet. So you put down the timetable and you follow it, even though you don't feel like doing it. But at the end, when you look back, you actually feel better than if you were to lie in bed all the time. Okay.
Behavioral activation, family members and friends actually have to start off. Because what's happened is that if it's the kind of depression where they just like to lie down in the room, they don't want to move or anything, you literally almost have to drag them out. Okay, so and then they'll probably scold you. All right, so if you want to help, then you got to have very thick skin. They may scold you and yell at you. All right, but remember, it's not your friend talking, it's not your family member talking, it's the depression talking. I mean, we can tell children the depression is like a monster. It wants to hold you here. Okay, but you know how you can fight the depression? You walk. The monster doesn't want you to walk, but you walk up. Take a walk, take to play something. You do not have to take the person on a 1 hour walk. If it's the first time, the fact that the person gets out of bed, puts on clothes, puts on shoes, goes outside and walks, even if it's for 5 minutes, it's fine. Then the next day, walk a bit longer. All right? So just step by step. Yeah. Next is to encourage exercise and healthy diet.
Okay. People who are depressed also tend not to exercise. They tend not to eat properly, right? Especially if they are staying alone. So it's important you put them back on normal diet, regular meals, breakfast, lunch, dinner, and then regular exercise. So that will help also.
For people who are severely depressed and they don't want to eat, and this can be old people, okay, no need to have a fight about the food, okay. So what you do actually is you can actually go and buy, what are these? These milky drinks are Complan and Anacal. They have vanilla flavor and chocolate flavor. So if they are not going to eat, you give them that, because that actually has the nutrients. Okay, so don't fight about food first, because if you are very depressed, it's very difficult even to what, to chew everything. Any movement is very difficult. All right. Then psychoeducation of child's difficulties or the patient's difficulties.
Yeah. So nowadays we computer is very easy. So if a husband has a depressed wife, husband need to find out more about what is depression. Just Google and look. How can I support my depressed wife? So you just type the question and there's a lot of information online. Okay. Or how can I help my depressed teenager? Or how can I help my depressed elderly mother? So there are a lot of information. Just type the question and you can find. Next.
Okay. Psychosocial treatments, creative or play therapy, cognitive behavioral therapy, interpersonal therapy, family therapy, and others.
Cognitive behavioral therapy is quite commonly used to treat depression. The theory is how a person thinks affects how he feels. So a person who is depressed tend to think depressive thoughts. So people who are depressed usually will say, I am not lovable, nobody loves me, nobody cares for me, my future is very gloomy. So these are thoughts that are linked to depression. So the more he thinks that he's a failure, he's unlovable, the more he will feel depressed, right? So in CBT, a way to help the person, one is to get him start doing something. Okay, if he feels that he's a failure, and the more he lies in bed, the more he will feel useless. Get him up and ask him to help you clean the fridge lah, help you to mop the floor lah. So after he has done the mopping, then he cannot feel useless because he has just helped you mop the floor. So that is one of the ways to help him change his thoughts. Other ways are getting him to see a counselor. That there are self-help books that you can download for the person. There's a website called mindovermood.com. You can go and have a look. MINDOVERMOOD. Mind over mood.
Your mind over mood.
One word, no spaces. .com. So this is set up by a cognitive behavior therapist who teaches people certain ways how to help themselves with CBT. Okay.
By the way, what is family therapy?
Family therapy is when the depression is caused by unhappiness in the family. Let's say the mother is overworked looking after the children, and then the father is displaced, is in the periphery, doesn't take part in helping the family. So the child, maybe the mother feels depressed. So in family therapy, we change the system a little bit. We encourage the father to come in, help more with the family chores, give the mother some rest, get the children to have more activities with the father. So different things we do in the family to change the system. And a lot of times when the the family relationship is made better, the teenager or the child will feel happier.
So a lot, actually, for young people and for children, a lot of their problems are actually, all right, caused by some other problem in the family. So there was this case that Dr. Lai has. There was this man did well at his work, so he had a promotion, and he had to work in another office, so it's further away. Okay, and sometimes he will stay back in the office. A lot of work, he didn't come back. So what happened was, the girl, the daughter, was about what, 6 years old, 7 years old, started having this kind of stomach pains and all that. No, so the mother took her to one doctor after the other. They did the scans, all okay, but she still had stomach pain. Okay, and her stomach pains were especially bad when the father comes home and starts, shouting at the mother and all that. Before, the father wasn't like that. The father would come home, play with the girl and all, but he was very stressed in his new job, and it's far, and on top of that, sometimes he's away. So, all right, brought to see Dr. Lai, and then, he realized that the child was the mirror. Okay, the child was mirroring the unhappy family at home. And so when the girl is sick and has to go to hospital and all that, there's pain, the father will come and sit next to her, take leave and sit next to her, and stay with her. So finally, in the end, when Dr. Lai realized that actually the cause of the child's stomach ache is somatic. I mean, somatic means it's actually not a physical cause. All right, she has the stomach ache, but there's nothing wrong in her body. What happened was in her mind, in her emotions. So the father asked to be transferred back. Okay, and no more stomach aches. Next. Positive parenting programs, the Webster Stratton Incredible Years program, Triple P, Magic 1, 2, 3, and others.
A lot of families are not happy because parents are worried about their children's academic performance. They will scold their children and punish them for not doing homework, and so it makes the family environment very stressful and negative. Nowadays, there are many positive parenting programs all over the world which are very effective. We actually promote it to young parents who have young children. Instead of using scolding and punishment and caning, this positive parenting program teaches parents how to use other ways. Okay, they use positive attention, they use praise, they use reward. I like to tell the story of the circus. Long ago, circus, they use the cane and the whip to get the animals to do things for them, right? The trainers. Nowadays, you go to the modern circus, you no longer see the cane and the whip. So how do they get the animals to do what they want? They give them rewards, they give them food. Okay, when a dolphin jumps over the loop, after that, he gets a small fish to eat. So the dolphin is happy, the trainer is happy, everybody is happy. Last time they used the cane, you whip the tiger jumps over the loop, the tiger is angry with you, you are frightened of the tiger, so everybody is not happy. So we want to teach parents how to make everyone happy and in the end also still get what you want. Okay, so those parents who are interested can look up this positive parenting program. In Penang, the SFEO is running a positive parenting online course. Okay, so those of you who are interested can contact Indranee later. Next.
All right, next. Okay, Incredible Years Basic Parenting Program. This is the one that we are running now in Penang in English, Mandarin, and Bahasa. Tamil is on the way. So this is what the program focuses on. One is play and attention. Next, praise and rewards. Thirdly, clear commands and setting limits. And fourthly, handling misbehavior.
Just to give you an example, I think we can show you a video. It teaches teaches parents to give praise to children when they behave well.
The video, please.
Regardless of whether the reinforcer is attention, a hug, a smile, or verbal praise, the task of teaching a child a new behavior is a long and difficult one, and often very slow. It means trying to reinforce the positive behavior every time it occurs. If there are two parents in the family and they can both participate, things should go more quickly. Both parents should talk about what behavior they want to improve and what reinforcers they will try to use. In addition, adults can add to the impact of their praise by talking to each other about how well the child is doing. Watch how the parents in the next vignettes do this.
These children played so well today together. They didn't fight, they played in the basement, they played upstairs, and Peter helped with the table, and Katie helped me cooking.
Well, it's great to hear that. They sure are good kids.
Yeah, they are.
So what happened is that the mother, all right, didn't praise the children directly, but she told the father exactly what the children did. She didn't do this, The children were very good. Oh, very good, very good. That's what we like to do. She said the children played well together. Okay, so one of the things about praise is this. You want praise to be effective. You want praise to, all right, work. Tell specifically why. Okay, very good job. You put away all your toys. Okay, well done. Okay, you came the first time I called you. Because sometimes you have to shout the name all the time. All right. Oh, very good. After lunch, you put all the dirty dishes in the sink. Good job. So be specific. What is it about the behavior that is good? Now, when you are specific like this, you can actually even praise the so-called naughty child, isn't it? Every time you saw the child, you're always scolding. Every time you see the child doing something good, thank you. Okay? Thank you for putting your cup in the sink. Then the child will, wow. And then what happens is that the child will like it though. So next, then he does something else, you keep praising and praising. Right? The more you praise a certain behavior, the more of that behavior you should see. Because they like hearing your praise. So they do more. Okay. Clear commands are okay. Okay. Next. Parents' most powerful tool will be attention. We're not showing the video.
Okay. So example, in this time of COVID, if you have children at home, when they are playing quietly, it's important that you don't wait until they make noise, then only you go and see what is happening. So when they are playing quietly, you stop your work little while, just go over and say something. You say, oh, you're good children, you're playing so quietly, and brother and sisters are sharing toys with each other. Then you go back to do your work. Then every 15 minutes or 20 minutes, you go over and, you are playing this one. So you give attention when they are behaving well. Don't wait until they start fighting and crying, then only you go. When you do that, what you're telling them is, you must fight and cry before daddy, mommy come to see you. which is a wrong message that you want to give your children, right? Okay.
Okay. Next, please. Next slide, please. Okay. If you were to meet Cinderella's fairy godmother, 3 wishes.
When I do counseling, sometimes I like to give this question. And when I ask this question to someone who is depressed, a lot of times they'll tell me, no wish, I don't have any wish, because they are too depressed to wish. But if you're not depressed, you can ask yourself, what would I want to wish for? This one helps you understand a little bit about yourself, what are the things you really like. Okay, next.
Right. Medications, antidepressants.
Okay, a lot of people have a lot of wrong ideas about taking medicine for depression. Recently, I have one patient who said she don't want to take medicine because she's afraid of being addicted. Then I asked her, your father takes medicine for his high blood pressure or not? He said yes. Then I said, is your father addicted to his medicine, the high blood pressure medicine? Then she think, and said no. So if your father has high blood pressure and he takes medicine for high blood pressure and you don't say he's addicted, if you are depressed, you take medicine for your depression, why do you say you are addicted to the medicine? So a lot of times we think in a strange way when it comes to medicine for mental health, okay, for depression, for anxiety. So medicine for treating depression is the same as medicine for treating diabetes and high blood pressure. They are just medicine. You don't get addicted to this kind of medicine, okay? And usually we advise patients for the first time, if you are depressed, you take it for 6 months. After that, you can stop. Okay, it's only when the depression comes back, then you may have to take it for a longer period. Okay, so there are many types of medicine nowadays for treating depression. So if one medicine doesn't work for you, try another one. We have an auntie who had high blood pressure. The first doctor gave her a medicine for high blood pressure. It caused her leg to swell. But because of that, did she stop taking medicine? No. She go to another doctor and ask for another type of medicine. And then that medicine caused her to cough. So did she stop taking medicine? No. She go to another doctor and the doctor gave her a third medicine, and this medicine helped her. So when you are depressed, you try one medicine and it doesn't work, why do you stop? Just go and ask the doctor for another medicine, different one. Try until the medicine helps you, right? There's so many different types of antidepressant medicine that can help people nowadays. Okay.
Right. Now, what we have discussed so far actually is depression. We touched a bit on depression with children, okay? And then, okay, new mothers, women who have just given birth to babies, okay? I remember there was a case several years ago in KL. This woman was working in one of the big accountancy firms and quite high up. So she had a baby, and there was a Indonesian maid at home with her. The Indonesian maid was doing something, came back, baby not there. Okay, the mother was also not there. She jumped off the balcony. They lived in a condominium, both mother and the child. So depression needs treatment. It can kill. Okay, it can kill. Right? Then where adults and all are concerned, cognitive behavior therapy, family therapy will be useful. We shared some bits about the what about children. So because children, the treatment is a bit different. Yeah. Now we have time for questions. Feel free to ask.
Back to Grace.
Okay, thank you, Dr. Lai and Datin Indranee for the lovely sharing. Now is our Q&A sessions. So audience, you are welcome to submit your questions in our live chat and Dr. Lai will answer your questions one by one. So if you have any questions, please type your questions or feel free to put it on our live chat.
While waiting, just want to tell you all that there are a lot of famous people who has depression before. One of them is Sir Winston Churchill, the former Prime Minister of United Kingdom. Winston Churchill was the one who helped England win the Second World War. Okay, so he has a very bad depression. He calls his depression the black dog.
So in Australia today, there is the Black Dog organization. You know what's a Black Dog organization? Anti-depression. Okay, it's like charity that works on depression. So they are the Black Dog.
Okay, I think there's no questions from our audience. So once again, thank you, Dr. Lai and Datin Indranee for today's sessions. And thank you everyone for your participations. Have a good weekend. Have a great weekend and bye.
Bye-bye.
Bye-bye. Thank you.
Bye everyone.